Good afternoon, everyone. Welcome to Age-Friendly Edmonton's Lunch and Learn on Assistive Technology. Thank you for joining us by Zoom. We are so happy that you are able to join us today. My name is Caroline G, and I'm your tech support today, and also the Age-Friendly Community Connector with the Edmonton Seniors Coordinating Council. This event is brought to you by Age-Friendly Edmonton, a collaboration between the Edmonton Seniors Coordinating Council and the City of Edmonton. Age-Friendly Edmonton is part of a global movement to build age-friendly cities and communities, and is a city that recognizes the diverse populations and needs of seniors and actively supports their inclusion, engagement, and well-being. We want to honor those who came before us. We have this opportunity to learn and share knowledge together. We acknowledge the traditional land on which Edmonton sits, the territory of the Treaty 6 First Nations, and the homelands of the Métis people. We would like to acknowledge and thank the diverse Indigenous people whose ancestors have occupied this territory for centuries. Together, we call upon all of our collective honored traditions to work in building this great city of Edmonton for today and for future generations. So now it's my pleasure to introduce you to our presenter today. Sheena Jaffer is a member of our Age-Friendly Edmonton leadership table for the past 4 years and has a great passion and keen interest in the area of assistive technology. Over the last 10 years, Sheena has been largely working in the area of aging with a specific focus on aging in place and assistive technology. Sheena is a certified aging services professional and certified aging in place specialist. I will let Sheena share more about her background and how she became interested in this area. Sheena?
Thank you, Caroline. Thank you, everyone, for making the time to join us today. To share a bit of a background, my journey with assistive technology and its appreciation began when I was a primary caregiver to both my parents when I lived in Edmonton back in the early to late 90s. We lived together, and at that time, I did not know the term aging in place, but I could clearly see that their needs were changing, and we had to make some adaptations to our home in accordance with their safety and well-being. Through this journey, I was initially introduced to low-tech items, such as grab bars, handheld shower hoses, and bath benches by an occupational therapist at the time. A few years later, when my father had a stroke, which was in the early 1990s, I was introduced to more devices, such as canes, walkers, and wheelchairs, among other items. During this time, I experienced firsthand how small yet creative interventions could make a big difference with my father's paralysis. As an example, I witnessed how my brother's creativity and mechanical acumen, a do-it-yourself solution to affix a lever to my father's bed, enabled him to get up with relative ease on his own, which he could not do prior to this intervention. So over the last decade, I have spoken at and attended many conferences that have enabled me to witness and appreciate the evolving world of assistive technology firsthand. These conferences have been invaluable in furthering my knowledge, and it is a great pleasure to share this presentation to enhance your awareness of this field. As you're listening to my presentation, please feel free to put your questions into the chat box. Caroline will be collecting them, and I will do my very best to answer them during the Q&A at the end. Thank you again for being here. And so now, Caroline, please go ahead and play the presentation. So the title of the presentation today is The Assistive Technology Ecosystem, Making Your Life Easier with Assistive Tools, Devices, and Aids to Daily Living. On this word cloud, what we see depicted here is what assistive technology can do for you. Based on my interactions with older adults, two key words are to view assistive technology as a pathway to remain independent, safe, and feel empowered in one's own environment. And another way to appreciate assistive technology is that it makes things easier for persons without disabilities, but technology makes things possible for persons with disabilities. For the purpose of our presentation today, we have 4 objectives. First, we will define the term assistive technology. Secondly, we will learn more about the assistive technology ecosystem and the range of thousands of devices that support functional limitations, individual needs, and preferences. Next, we will provide some examples of assistive technology that can be useful both for older adults and persons with disabilities that may be aging in place. And finally, to learn about helpful resources for identifying and purchasing options for assistive technology. Let's begin with the definition. In addition to what I have on the slide, assistive technology is devices and tools used for performing functions that might otherwise be difficult or impossible. As all of us grow older, it is common to experience gradual changes in hearing, memory, vision, or mobility. Many times, these changes create the need to do everyday things a little bit differently. For instance, some people walk with the aid of a cane, others watch movies using an assistive listening device, and others may read newspapers or books with a lighted magnifier. Assistive technology is linked to both the aging and disability fields. It is an umbrella term covering the systems and services related to the delivery of assistive devices and services. Services include awareness, training, information, fitting, and technical support. Put simply, it is the whole ecosystem that is needed for their safe, effective provision and use. Assistive technology devices usually fall into one of 3 categories. These are low-tech devices, which are usually inexpensive, easily made, easy to learn, readily available, easy to replace and maintain. In some cases, you can even make your own. And we will cover more about the do-it-yourself solutions later in this presentation. We then have mid-tech devices, which may cost more, require some training, may have a special design, and may often need a power source. And finally, we have high-tech devices. Generally, these have higher cost, require specific training, and often customized to suit individual needs. In summary, assistive technology includes thousands of simple to complex and digital devices, which can be used in your homes, in a workplace, or in the community, with the aim to reduce barriers and empower personal abilities. So hearing aids, communication devices, computers, tablets, specialized software, home or vehicle modifications are all categorized as assistive technology. Anyone who needs assistance in performing the activities of daily living and the instrumental or major life activities can benefit from assistive technology. Some of our daily activities that we all perform include eating, dressing, bathing, and we also have activities instrumental to our daily routines, such as driving, preparing meals, and managing medications. For each of these activities, there are a number of tools and devices available that you may find useful in carrying out these tasks. Assistive technology is also referred to as aids to daily living. So in the next few slides, we will now explore some examples for some of these daily activities. Let's start with hearing devices. Some of the examples of assistive technology devices include hearing aids, vision aids, eating food and preparing food aids, mobility, writing aids, medication management, dressing, driving aids, and technology applications. Let's begin now to look at some of the hearing assistive technology. Hearing devices can help you function better in your day-to-day communication situations. These devices can be used with or without hearing aids to make hearing easier for you. There are many devices available in the market today that can help you stay connected. For example, personal amplifiers are often used as a first step before getting hearing aids. When all you need is just a little more amplification, these can be really handy. On the slide, we also have an image of a personal amplifier, which can help you hear better in small group settings or on one-on-one conversations. There are also several types of wireless TV listening devices, such as the TV ears. This type of a headset allows you to adjust the volume that's comfortable for you without disturbing others. If you have trouble understanding on the phone, there are a number of amplified phones that are hearing aid compatible and have a built-in flasher that alerts you visually to incoming calls. There are also caption phones available that display every word the caller says as you listen along. For those of you who may have trouble hearing the doorbell or the telephone ring, there are flashing and vibrating signals that can alert you. These are easy to install and will let you know when the telephone or doorbell ring with either a loud chime or a flashing light. If you have trouble hearing the alarm clock, there are signals that wake you up with a loud alarm, a strobe light, and a bed shaker. There are also visual smoke detectors to wake hard of hearing people to serve as an alert of smoke, heat, fire, and carbon monoxide danger. We will now look at some examples of vision assistive technology. Some of the images on this slide include a large dial remote control, a large print clock and watch, large print computer screen, and low vision playing cards. Many simple devices can help those with low vision, such as magnifiers, telephones with large numbers, large print versions of popular games, clocks, watches, thermometers, and blood sugar monitors. As well, there are a range of computer products, such as character enlargement systems and Braille devices. For card players, there are large print playing cards, card holders, and automatic shufflers. We will now look at some examples of eating and food preparation assistive technology. These include large, easy to hold and grip utensils, cutting boards, openers, and knives. Images on the next couple of slides include a Swedish cutting board, a multifunctional food preparation board that makes kitchen tasks easier and safer. It holds food for one-handed cutting. It has spikes to hold objects securely in place, for example, a carrot or an onion or a cucumber. It can also hold jars or mixing bowls to assist with meal preparation. This adapted cutting board is ideal for persons who have arthritis or had a stroke or have neurological impairments that limit them to the use of one hand. Another item is a spread board, which holds bread in place while spreading jam or butter. Another example is a rocking tea knife. It's a stable, easy to use utensil that cuts food with a rocking motion. For those who have pets, the can claw opener can be used for pet food or other single serving cans. It's a unique tool that uses a little leverage to easily pull back lids with pull tabs. In terms of spoons, forks, and knives, there are a number of functional and lightweight utensils for those who have decreased grip strength, wrist pain, or need to keep the wrist in a neutral position. The design and contoured shape makes them easier to hold and use. We will now look at some examples of mobility assistive technology. There is a wide variety of canes, crutches, walkers, scooters, and specialized and sophisticated wheelchairs that are available to help you move around safely. For example, shopping scooters, rollators with seats, lighted canes to assist with low lighting and fall prevention. And in this particular area, there's a lot of different innovative designs that we have seen in recent years. For example, a smart walker, as seen on this slide, is designed with sensors to help with achieving a more natural gait and detect risk of falls. And you will see more examples of mobility AT, and it's one of the most commonly used items that I'm sure many of you are familiar with. We will now look at examples of writing aids. These are particularly beneficial for anyone with arthritis, missing fingers, or an arm in a cast. They are designed to provide a comfortable grip on a pen or a pencil, as well as on a razor, toothbrush, or other utensil. The writing bird, as shown on the screen, is a device for persons with limited hand coordination, dexterity, or a weak grasp. It is ideal for persons with arthritis or neurological disorders. And signature glides can aid with signing in designated spots. We will now look at examples of medication management assistive technology. Assistive technology that aid medication management have been constantly evolving and getting more and more specialized and efficient in the process. You will find dozens of both low and high-tech devices in today's marketplace. An example as seen on this slide is a device that improves patient compliance through monitored reminders and automatic dispensers, which include a loud voice alarm, text reminder, and a flashing light. Other devices include a pen pill case, providing a way to carry your pills when you are on the go. There are also pill box necklaces, a talking RX, which can tell you precisely how many pills to take, when, and what for. Your pharmacist records the prescription information right into the talking RX. It is ideal for people with low vision or hearing impairments. There are many other devices that can hold 1 month's medication with alarms at a specific time to take your meds. If you happen to miss a medication time, the tray will advance at the next scheduled alarm, and this has been very useful to prevent double dosing and medication errors. Next, we will look at examples of dressing assistive technology. This technology is ideal for people with arthritis, limited wrist movement, or any other limitations. These aids are useful for anyone who has trouble bending or reaching for things. Manipulating small buttons and pulling zipper tabs can sometimes be a difficult and frustrating experience. Devices such as button aids and zipper pulls provide extra leverage in performing these tasks. In addition, there are dressing aid sticks, trouser pulls, a mobility reacher, or a grabber, long shoe horns, socks and stocking aids, elastic shoelaces, and magnetic necklaces, which are easy to clasp. Some of these items can be helpful for those who have undergone a hip or knee replacement. There are also self-threading needles designed to help those with visual or range of motion limitations to sew by simplifying the threading of needles. Many of these items can be purchased from retail department stores, pharmacies, hardware stores, and as well as online. We will now look at some examples of driving aids. Driving assistive technology products are created with a few primary goals in mind. To enable you to drive using hand controls, to assist you or your passenger to enter and exit your vehicle more easily and safely, to obtain the safest and most comfortable seating position possible, and being able to transport a personal mobility device, such as a scooter or wheelchair, in the safest manner. Examples of assistive technology driving aids include seat transfers, mechanical hand controls, pedal extensions, brake pedal guards, steering knobs, and high-tech electronic controls. For example, if getting from one position to another is difficult, 360-degree rotating discs, also referred to as lazy Susans, make getting in and out of a car much easier. There is an explosion of applications now that are available over the last handful of years. These apps are designed to fulfill a particular purpose and are primarily accessed through mobile devices, such as mobile phones or tablets, and include apps such as memory aids, health and medication management, money, finance management. For caregivers, there are caregiving support and assistant apps, and there are leisure apps as well. There are many free apps in the market, and some of these are also available at a fairly nominal cost. Innovations in assistive technology have been evolving at a super fast rate. It's hard to keep up in many ways. In many ways, the future is already here. From driverless cars to a variety of robots to assist with any chore, the Internet of Things, virtual and augmented reality, sensors, smart homes, to name just a few. The future possibilities are really endless and constantly evolving. And along with that, assistive technology is becoming increasingly available and affordable to all. We are now seeing innovations specific to the pandemic. On this slide, you will see a door with a shoe pull that lets you open the door using your foot instead of your hand. It is designed to minimize the transfer of the virus and other germs, leaving your hands clean of harmful germs and perhaps free to carry out other tasks. I also wanted to share with you the do-it-yourself or make your own assistive technology, as I had mentioned previously. It's called the Maker's Movement and is a cultural trend which places the onus on a person's ability to be both a creator as well as a consumer of things. In this culture, individuals who create things are called makers. And makers come from all walks of life with diverse skill sets and interests. Many of us who have come from the developing countries in East Africa or Asia have witnessed the creativity and skillfulness of people making items to support their needs. Considering some devices can be costly, the Maker's Movement is beneficial in supporting access to affordable assistive technology. Here are some examples of the Maker's Movement devices produced by a 3D printer. On this slide, we have a key turner, allowing people with reduced dexterity or grip strength to insert and turn keys in locks. For people with arthritis, this device can be operated with little or no grip or strength. This is an open source assistive technology, which means anyone can use this design to make their own. 3D printers have been revolutionary. For example, they are capable of printing prosthetics and orthotics as well. On this particular slide, we have a lady who suffers from paralysis. And she is showing us items that she has made from repurposed corrugated plastic. She has made 2 cuffs, one for eating and one for drinking. And she has also made a mobile device stand. Other examples of do-it-yourself items are iPhone stands for a person with Parkinson's to type on their smartphone, a book holder for a wheelchair user, a Lazy Susan for iPad, and much more. If you are interested in exploring this area further, here's an example of a manual for do-it-yourself assistive technology. We will now cover some of the questions relating to whether assistive technology can be right for you. So when activities like operating the TV, remote, getting in and out of bed or a bathtub, car or bed, talking on the telephone, or remembering to take medications is difficult or impossible, you will benefit from assistive technology. On occasion, individuals may express stress, embarrassment, shame, denial, and other negative emotions about using assistive technology devices and tools. The purpose of assistive technology is to unlock your potential. So in reality, it serves to improve function and enhance your independence. And it should be something that you should feel very comfortable to embrace. Assistive technology devices can be customized to suit an individual's needs by a number of professionals, including assistive technology practitioners, occupational therapists, physical therapists, rehabilitation engineers, speech-language pathologists, your caregivers, other assistive technology users, and certified aging-in-place specialists. On this slide, we have a number of questions to consider based on your individual needs. For example, you may ask, what are the tasks that I need help with? What types of assistive technology is available to meet my needs? What type of assistive technology will give me the greatest personal independence? Or how up to date is this piece of assistive technology? I will share some insights in relation to these questions. When it comes to AT, an important factor to take into consideration is that one size does not fit all. If you think you can benefit using an assistive device, a good step is to begin by consulting a healthcare professional, such as your doctor, pharmacist, or occupational therapist. It's important to take the time to research what is available to suit your needs. And in addition, ensure that you're familiar with some dozens of websites where you can find information about assistive devices and as well as from catalogs or seniors magazines and newsletters. In some cases, family members and friends may also have experience and useful advice for you in this regards. For devices such as corrective eyeglasses and hearing aids, it's important to be assessed by a medical professional. Professional assessment is important when purchasing an expensive assistive device, such as a wheelchair, particularly if you know you may qualify for full or partial reimbursement. Generally, most forms of reimbursement through insurance or another funding provider do require that you get a prescription for the more expensive assistive devices. Many low-tech devices, including walkers, canes, and grab bars, are available in general or specialty stores, including pharmacies and medical supply stores. Hardware and department stores offer many assistive devices as well. You can find items such as screen reading software for people with reduced vision and modified keyboards and mice for people with limited mobility at specialty computer stores. We will now go over financing options for assistive technology. As needed as assistive technology may be, it is not always easy to acquire, especially when you do not know that these items exist. Overall, it does take expertise to find the correct devices and find ways to acquire them. I want to emphasize that assistive technology can mean anything from simple to do-it-yourself low-cost items to highly sophisticated devices ranging from a few to thousands of dollars. From what I have learned, as of now, there is no single public program or private insurance that will pay for every type of assistive technology. Some provinces and territories do have programs for seniors or people with disabilities to buy the assistive devices they need, provided the items meet the definition of durable medical equipment, such as wheelchairs, hospital beds, or bedside commodes, to name a few. Other possible sources of financial help may include community and nonprofit organizations, for example, Kiwanis, Lions Club, Rotary, or the Royal Canadian Legion, and Veterans Affairs, which helps eligible clients with the purchase of devices that improve quality of life and maintain independence. Other useful factors to take into consideration include the fact that assistive technology that you wish to, if the assistive technology you wish to purchase is expensive, it's a good idea to find out if you can rent or borrow one to help assess your needs before you purchase. It is extremely important that you obtain these devices from reliable sources, particularly medical devices such as hearing aids or eyeglasses. A high degree of caution is recommended if purchasing medical devices online and buying recycled or secondhand products. And finally, always take time to carefully read and follow all instructions before using your assistive devices. In addition to yourselves, your caregivers must also know how to use these devices properly. And with that, I would like to thank you for taking the time to learn. I really hope you have taken away some useful tips, and I'll be happy to answer any questions that you may have.
Thank you so much, Sheena, for this great presentation and information on technology today. There is certainly a lot out there. I actually have a couple of questions, maybe to start us out with. Where can we find some of these items that you talked about in your presentation? And of the technology, what have you found sort of most impactful of these items, especially someone that might be on a budget?
Right. Okay. So you have a number of questions for me. In terms of impact, I guess it's a very individual situation, right? Some people, depending on their needs and depending on the functional aspects of their day-to-day living, I mean, they could benefit from simple items such as, like, I have an item here, which is a jar opener, which can easily open a jar. And it's a very simple, it probably costs $1 and it can make a lot of impact in a person's life. The world of assistive technology is evolving at a really fast pace. And every day, someone like me who's been in the field and has gone to numerous conferences and has seen all these devices, also am amazed at the new things that come out all the time. So, in relation to the functional limitations that one has, there's a lot of devices. And so I would say that it would be good for everyone that's here today to learn more about assistive technology by visiting some of the websites that we will be sharing with you, where you can watch even videos of how assistive technology is utilized for different limitations that a person may have. Carolyn, I believe that we will follow up with that through an email or perhaps even post them on the website or something, correct?
Yeah, that's correct. Sheena's put together a lovely one-pager, two-pagers of websites where you can do your own research and to gain additional information on technology. So I'm hoping to send that out with the survey. We always do a survey after these lunch and learns. So we'll hopefully get that out as soon as possible. So that was my question. And we do have, I see a couple of hands up. Tatiana has a question, so go ahead.
Thank you. Yeah, sort of to build on the same conversation about looking for available technologies and doing your own research. I'm a social worker and I do work with seniors, and I find it extremely frustrating to spend not even hours, days on doing this kind of research. And I've been extremely disappointed many times of talking with occupational therapists and physiotherapists who know very little about what's available on the market outside of what the province can fund. So it comes back to the time that I spent doing the research when either a client or my organization has funds to cover it. So I'm just curious if you know about any attempts of creating this information hub, let's say provincially or maybe nationally, where people can go and find information without spending hours of doing this kind of research. Has been those attempts occurred? Something's been done. So far, I couldn't find anything. But I was wondering, maybe you're aware of something that is been happening in this direction. Thank you.
Yeah, well, thank you, Tatiana. That's an excellent question. And it's something that we all try to grapple with. As I mentioned in my presentation and earlier in my comment, there's thousands and thousands of devices that fall under the umbrella of assistive technology. And you're absolutely right that we need one place to go to find out about all of these and not have to go all over the place and see what's available where and how and so on. I worked in the United States, and in the United States, there is an Assistive Technology Act, and every state is required to have a program. So there's much more access to resources and demonstration of devices there. We do not have something similar in Canada based on all the research that I have done, but it's something that is coming to the forefront very fast now. And in fact, Caroline and I have been talking about ways in which we can make it more easy and I think easier and much more efficient for Edmontonians or Albertans to be able to find out more about this technology. So I do not have an answer for you in terms of, yes, there is something, but it's something that is we've been thinking about, and I hope that we can come up with something that will be useful, particularly to the the massive aging population that we have now. And any great ideas from people like you would be great. You're right. I think it would be nice to have a hub, an assistive technology hub where people can go to and learn more and find out all the information they need. And I think it's time for it. And I hope that we can come up with something very useful for everyone.
That's great, Sheena. Thank you so much for addressing that question from Tatiana. I'm just wondering if there's any more questions. I don't see anything in the chat at present, but if anything comes to mind, if you have a question, yeah, you can turn on your mic and ask the question now.
Can I ask another question?
You sure can, absolutely, thank you.
Sorry, it's a really dear to my heart subject, and I'm a huge fan of assistive technology and really try to do my best assisting my clients with accessing. So do you aware about any private assistive technology practitioners in Edmonton that I can refer my clients? And thanks for the sharing the right vocabulary. You know, I wasn't aware about the fact that this kind of profession exists, assistive technology practitioner. So I just very quickly Googled, and I found that I believe it was Glen Rose that has at the Glen Rose Rehab Center, they have some sort of program. So that would be at least one direction for me to have a conversation and refer my clients to. But I was wondering if there are even private assistive technology practitioners that exist in Edmonton, and if yes, where I can find them.
Yeah, so so a lot of the assistive technology, like I mentioned, I worked in the US, and we have a lot of assistive technology specialists, but you will find assistive technology specialists in every educational institution. For instance, the University of Alberta, the NAIT, in high schools or primary schools, or because assistive technology is not just for seniors, it is for a person of any age. And so you will often find the services in those areas. Like schools, for instance, are required to have an assistive technology specialist. But you are talking more in relation to an aging, the needs of an aging population, if I'm correct. Right. So yeah. So I think in relation to that, I have not really come across anything here in Alberta, based again on everything that I've looked at. But it's certainly an area of need, and I think more and more people are waking up to it. But Tatiana, I would love to make sure that you have my contact information, because I think there's a lot that we can discuss, and I can point you to some definitely some areas where you might find it useful to learn more about how best to access some of these really needed assistive technologies. Mm-hmm.
That would be great.
So,
thank you,
Caroline, to pass on my contact information to you, and certainly let's have a chat, and I can certainly expand more on some of the things that you are talking about.
Mm-hmm. Thank you. I appreciate it. Thank you.
Great. Thank you.
Thank you, Sheena. Thank you for the question, Tatiana. And I can put the two of you in touch, not a problem.
Great. Excellent.
Yeah. Any other questions? I don't see any more. I don't see any other hands going up. And so 3, 2, 1. I guess we'll conclude our lunch and learn this afternoon. And if you do have any questions that come to mind later, Please don't hesitate to email us at agefriendlyedmonton. The email address is agefriendly@edmonton.ca. That's agefriendly@edmonton.ca.